Hello, welcome to another video. Today I'm going to be talking about what is PANDAS. Beans, that's what it is. So if you are new to my videos, you probably don't know, but I have tics. So if I do something weird like or say beans or flip you off by accident, I'm not meaning to. They're tics and they're uncontrollable. And they're actually caused by PANDAS, which is what I'm going to be talking about in this video. Today's video has taken a lot of preparation, so I'm hoping that I can get all of this covered. I wanted to focus on what is PANDAS, what are the symptoms of PANDAS, how is it treated, how is it diagnosed, and what my specific symptoms in case of PANDAS looks like. So let's get on with the video. Geez, sorry the intro was so long. Okay, so what is PANDAS? PANDAS is actually short for your mom. PANDAS is actually short for Pediatric Acute Onset Neuropsychiatric Syndrome. Jeez, that's gay. Wow. Okay, so that probably does not mean a whole lot to you. It's just a bunch of big words. So let's break that down. PANDAS is an infection-induced autoimmune disorder. This basically means I got an infection and my body made the antibodies to fight off that infection, which was Lyme disease in my case. And the antibodies started fighting that infection, but not only that infection started attacking my body because it's an autoimmune response. It specifically started attacking my brain because it is a neuropsychiatric syndrome. When your body is basically attacking itself, it can cause a lot of inflammation, and that can just be its own whole thing that is not good. That's gay. Keep in mind that pediatric is in the name of PANDAS, but it is not actually just a childhood thing. You can get it at any age. Okay, next topic. What causes PANDAS? I'm gay. It's my notes. Okay, beans. That's what causes PANDAS. No, it's not. Beans. Okay. Sorry. So in my case, it was Lyme disease, but it can also be caused by, let's look at here because I'm not going to be able to remember these. Wow. Mycoplasma pneumonia, herpes simplex, influenza, and the common cold. Wow. Wow. There are more infections, but I'm not going to list all of them, obviously, so I'll leave it a link in the description if you want to go learn more about PANDAS and see more about the infections that can cause it. So PANDAS is actually the same thing as PANS, which it's not an actual panda, but baby, beans. It's not like the bear. PANDAS, I'm pretty sure is dead because I died. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. So it is basically the same thing as PANS, but only caused by things like strep. With PANS, the exact cause is unknown, but it is known that it is caused by infectious things like Lyme disease, and even some non-infectious things like metabolic issues and sometimes even stress. So there's not one single test that you can do to discern whether you have PANDAS or not, but a doctor might do things like a blood panel or asking a series of questions as to like when your symptoms started. My doctor, what, dude? Hey! My doctor concluded that I had PANDAS because I had OCD and anxiety before I got Lyme disease, but everything got worse after Lyme disease, and I got all of these sudden tics, which was a big indicator that I had PANDAS. So he started treating the Lyme disease with antibiotics. Ding, ding, ding. And yeah, usually that helps with PANDAS by treating the triggering infection. PANDAS usually calms down, but in my case, it wasn't it. So he started treating them with steroids, which prednisone. But by the way, I'm dying. This is not like any substitute for going to a doctor or medical advice. I'm just talking from my experience, research that I've done, and what other people have told me. Okay, so the things that my doctor looked out for were when my symptoms started in comparison to when I got Lyme disease. My OCD and anxiety and these tics were through the roof. Wow! As soon as I got Lyme disease, which was a big indicator of PANS. He also looked at how I responded to treatment, basically, to see if PANS could be a possibility. Another thing that doctors usually look for when looking for PANS is how fast the onset of the symptoms started. A lot of the times with PANS, the patients will know the exact day and time that all of their symptoms started. It's like a snap. It can happen overnight almost. Wow! Okie dokie, let's take a look at some of the symptoms with PANS. So PANS-PANDAS is not a psychiatric condition, although it does cause neurological and psychiatric symptoms. These symptoms may include OCD, rage attacks, tics, increased anxiety, separation anxiety, developmental regression, sleep problems, dilated pupils, anorexia, eating issues, ODD, beans, increased any like other prior mental disorders that you had, like if you had tics before, like seeing if they've increased in severity. Also things like OCD and anxiety, seeing if those types of things have increased in severity. Beans. Severe brain fog, new sensory issues, beans. Big one is the problems like with handwriting. A lot of people, their handwriting will get really messy, or their math ability will severely decline. A lot of the times with PANS, urinary frequency will be increased, and a lot of people have problems with bladder control. And PANS can cause severe depression, mood swings, suicidal thoughts, meltdowns, memory loss, wow, that's gay, ADHD-like symptoms, and gayness, new sudden irrational fears, joint pain, wobbly fingers, and loss of coordination. That is quite the list. Wow! And I'm sure I didn't even cover all of them. So some people won't have all of these symptoms. Most people don't have all of these symptoms. Not everybody will have all of them. Everybody will have a different arrangement of them, if that makes if that makes sense. Some symptoms that are quite common with PANS is increased OCD, anxiety, food sensitivities, tics, sleep disturbances, changes in thinking patterns, wow, brains, and severe brain fog. Those are some of the more common symptoms. I personally noticed a big increase in my OCD. I already had some OCD tendencies before, but after this it got a lot worse, and my separation anxiety and just generalized anxiety all got a lot worse as soon as I got Lyme disease and cute and my mum and my PANS set in. And obviously, yes, tics. I noticed tics. Tics were one of my symptoms. I don't really notice any food sensitivities, like newly developed, but I did notice I have a weird fear of choking ever since I got PANS. Like anybody around me choking, myself choking, like it's been really weird. A lot of people in my videos have noticed that my pupils are weird and dilated. That could be caused by PANS, but it could also be caused by my medicine, so I don't really know what to chalk that up to. I also noticed brain fog and some memory issues. I have also been experiencing like very short temper and like rage attacks. When something is like slightly annoying, I can't even like control that anymore. It became very, very hard with PANS. But that could also be because of steroids. I also noticed that I started developing more heightened, worse sensory issues, if that makes sense. I already had them before, but PANS made them worse. And it also affected my sleeping. I started not being able to fall asleep very well, waking up constantly, waking up very early, and not being able to fall back asleep again, having really bad night terrors all of the time, beans. It was just not good. Keep in mind that this is just my set of symptoms, and no two people with PANS-PANDAS will be similar or the same at all. In some people with their PANDAS, the change can be so severe that it seems like it's not even the same person anymore. A lot of the times parents will go to the doctors and be like, I've lost my child, I don't know what to do anymore, because of how severe and how much the PANDAS changes their child and regresses them. Beans! You think this is a laughing matter? That's gay. It's also important to keep in mind that sometimes people with PANDAS will have times where they don't have any symptoms at all, and then their symptoms can overnight change and be debilitating. It's very, very crazy and unpredictable. Something that can also happen with PANDAS is flares. So if you are exposed to a trigger, your symptoms could get a lot worse and you could start regressing. Some triggers include infections, bacteria, allergies, and mold. And sometimes even emotional stress has been linked to a PANDAS flare. Okay, how is it treated? Baby, that's gay. Okay. Oh, wow. So, PANDAS is usually treated by treating the triggering infection. So I got Lyme disease, and Lyme disease is treated with certain antibiotics like doxycycline and minocycline. I was first put on doxycycline, but I got really nauseous, so we got me on minocycline, and that was supposed to treat the Lyme disease. So when that doesn't work, sometimes, in some cases it doesn't work, so in my case, we started me on steroids, prednisone, to try to help with the inflammation and get that down. A lot of people with PANDAS can also find behavioral therapy and other types of counseling helpful. Because it is very stressful, so it is good to have some sort of therapy. Recovery can happen, but it takes a very, very long time, a lot of the times, and you have to be very, very patient with yourself and your doctors. Wow. And a lot of the times you're gonna have to eat really healthy, like whole foods, staying away from dairy and sugar and carbs and stuff like that. Maybe not the carbs part, it was gluten. Sorry, I meant gluten, not carbs. Suck my nuts, dude, that's gay. You have to stick to a very strict medical plan, and you have to really, really, really try to get better. So a few things to note. So with PANDAS, usually the brain of that person is somewhat normal before they get PANDAS. So PANDAS will make all of their symptoms that they already had worse. It's not like somebody with autism or somebody that was born with OCD. A lot of the times when people get PANDAS, their brain is attacked, and therefore it's not your actual brain that's a problem, it's your immune system. About 1 in 200 people on Earth are thought to have beans. No, not beans. About 1 in 200 people are thought to have some form of PANDAS, which is crazy. I also wanted to mention that flares can last certain amounts of time, different amounts of time every time. They can be from days to even years. Wow, that's gay. Beans. The diagnostic criteria for PANDAS is that you have to have OCD and or tics to be diagnosed with that. And the diagnosis criteria for PANDAS is that you have to have OCD and or food restrictions. Beans. Wow! Usually OCD, tics, and food restrictions have to be present for a doctor to diagnose somebody with PANDAS, but this isn't the case 100% of the time. Suck my nuts. Something I wanted to mention is that symptoms can change between each flare, and baby, they can be different, completely different sets of symptoms. So I am having a PANDAS flare right now, where I have tics and OCD and rage attacks and things like that. Beans. But I could get it later. I could have another flare later in life, and I could have symptoms like hallucinations, seizures, food restrictions, and things like that. It could be completely different. Another thing to note is that not everybody with PANDAS has flares at all. Wow, that's gay. There have been genes found that some doctors think are associated with PANDAS, but nothing has been 100% confirmed. So what that means is people in families are more likely to pass PANS down to their children. So if one person in a family has PANS, another person in their family is also likely to have it. Beans. I'm dying! Okay, whatever. Oh yeah, something that I wanted to mention. So people with PANDAS can obviously have things like autism, anxiety, and OCD before they get PANS. That is like present in their brain, and their brain is the problem, which can make it very, very hard for most doctors to diagnose PANDAS. And a lot of the times, PANDAS is misdiagnosed as is diagnosed as one of the more commonly known things like OCD or beans or Tourette's. Just remember that PANDAS can be very debilitating and tiring to deal with. So if you meet somebody with PANDAS in real life, you know somebody that has it, please be understanding and kind to them. Thank you for watching my video today. I hope you learned something. And if you have any questions, please leave them in the comments. I'm going to be doing a Q&A on PANS and tics soon. So I would love to answer any questions that you have. Bye!